Welcome to Srigyan Rheumatology Clinic's educational video series. Have you ever heard of VEXAS Syndrome? It's a relatively new discovery in the medical field. Emerging from the expansive world of medical science, VEXAS Syndrome is a recently identified health condition. The term VEXAS is an acronym representing the features of the syndrome: vacuolase, E1 enzyme, X-linked autoimmune, somatic syndrome. As science unfolds the mystery of VEXAS, it's known that the syndrome predominantly affects men. Men with this syndrome can experience a range of inflammatory conditions, painting a complex picture of symptoms and health challenges. The discovery of VEXAS syndrome offers a new lens to understand and tackle these conditions, paving the way for more precise, targeted treatments. While the syndrome is relatively new to the medical lexicon, its impact is profound. It's not just about the physical manifestations, but also the emotional toll it takes. VEXAS syndrome may be new, but its impact on patients' lives is significant. So, what causes this intriguing syndrome? Well, the answer leads us down the fascinating path of genetics. VEXAS syndrome is caused by a mutation in a gene known as UBA1. This isn't your typical inheritance story, though, where traits are passed down from parents to offspring. Instead, this mutation arises spontaneously in the body's cells after birth, a phenomenon known as a somatic mutation. Now you might be wondering, what sparks this sudden change in the UBA1 gene? That's a question that keeps many researchers awake at night. The truth is, we don't yet know the exact reason why this mutation occurs. It's a topic of intense, ongoing research, a scientific mystery waiting to be solved. Despite the uncertainty surrounding its origin, one thing is clear. The UBA1 gene mutation is the unmistakable villain in the story of VEXAS syndrome. While the exact cause remains a mystery, the UBA1 gene mutation is the known culprit behind VEXAS syndrome. Now, how does VEXAS syndrome manifest itself? This condition presents a myriad of symptoms, which can often confound even the most seasoned healthcare professionals. Patients typically experience recurrent fevers, a symptom often mistaken for common infections. Skin rashes are another common manifestation, varying in appearance and often causing discomfort. But the reach of VEXAS syndrome extends beyond mere surface-level discomfort. It has the potential to cause damage to various body organs. The lungs, kidneys, and blood vessels may all come under attack, leading to potentially life-threatening complications. These symptoms may mimic those of other diseases, making the task of diagnosing VEXAS syndrome a challenging one. It's a bit like trying to find a needle in a haystack, seeking out the unique signature of VEXAS syndrome amidst a sea of common symptoms. This is a syndrome that doesn't play by the rules, making it all the more elusive. With symptoms so varied and deceptive, VEXAS syndrome certainly poses a challenge to healthcare professionals. Given these challenges, how do we treat VEXAS syndrome? It's a question that has been echoing in the medical community. With no definitive cure at present, the mainstay of VEXAS syndrome treatment is symptom management. This involves the use of immunosuppressants and steroids to control inflammation, which is a hallmark of the syndrome. Immunosuppressants work by reducing the body's immune response, thereby lessening inflammation and the associated symptoms. Steroids, on the other hand, are powerful anti-inflammatory drugs that can help manage bouts of inflammation that patients with VEXAS syndrome often experience. Looking to the future, gene therapy is a potential game-changer. As VEXAS syndrome is caused by mutations in a specific gene, the idea of correcting this genetic defect is a tantalizing prospect. While still in the realm of scientific research, gene therapy holds promise for a definitive cure. While there's no definitive cure yet, symptom management and potential future therapies offer hope. Let's revisit what we've learned about VEXAS syndrome. This complex condition is caused by mutations in the UBA1 gene, leading to a cascade of inflammatory responses in the body. It predominantly affects middle-aged to older men, presenting with a myriad of symptoms like fever, skin rashes, and joint pain, often accompanied by abnormalities in the blood. Treatment, as we've discussed, is primarily supportive and symptom-based, as there is currently no known cure. This includes corticosteroids to manage inflammation and antibiotics to combat recurrent infections, common in VEXAS patients. The discovery of VEXAS syndrome underscores the importance of continued research in the field of genetic disorders. As we peel back the layers of this syndrome, we inch closer to understanding its intricacies. This journey of discovery, while challenging, is crucial in our fight against the syndrome. VEXAS syndrome, a new challenge in healthcare, but one that the medical community continues to tackle head-on.